Hello, I'm Dr. GB. Nice to... Oh my god. Are you okay? Wait a minute. This chart. I've seen you before, haven't I? 2 times. I had to change professions because of you. And now you're here. I don't know if I'm ready for this. Are you? Okay. Welcome into your appointment. I will be doing an orbital exam today. How are your orbitals lately? Oh, I see.
Oh. Hello there. And welcome to the clinic. Yes. You're in Dream City Clinic. I am your doctor for this evening, Dr. Brain. Pleasure to meet you. Yes. Has a nurse already seen you today? Good. Well, let me look at your chart here, okay? What was your name again? Beautiful name. So, it appears you're here for the cranial nerve exam, but you must close your eyes, correct? Good. Let's start off by closing your eyes right now. I see.
Just remind me of your date of birth. Okay. And, did you have any conditions that I should be aware of? Slow down, please. Slow down. Gastric. What? Pulmonary. Okay. 4 times. 4 times? Okay. 4 times. And you were hospitalized for how long? Okay. Temporary blindness. Okay. Fake teeth. I see. They removed that. Then they put it back. Then they removed it again.
You haven't had gotten the best sleep in the past couple of weeks, so let's make sure that we get you ready now. So please close your eyes, and absolutely no opening your eyes, no taking a peek, none of that. Keep your eyes closed, otherwise we will have to redo this exam early in the morning, okay? So close your eyes, pinky promise. Very good. So what I'm going to do is a cranial nerve exam with sets of exams to test your intuition, to test all 12 cranial nerves and to help you fall asleep. Let's begin. I'm going to first start off by turning off the light, though you wouldn't see that because your eyes are closed, okay? And using just with your eyes closed, let me know the moment when the light flashes in front of your eyes, okay? So I'll ask you yes or no, and you let me know yes or no. Here we go.
Okay. Alright. Is that it? No. Okay. And asthma. Alright. I'm a little afraid to ask you what medication you're taking. You already submitted the binder to the receptionist. Okay, great. Thank you. So, what brings you in today? Really? Well, that is terrible luck, isn't it? And they brought you straight here, not to the emergency room. Sure, why not? Okay, well, no problem. I am indeed a medical professional, and I will be able to...
Yes or no? Good. Yes or no? Good. Yes or no? Good. Yes or no? Good. A little bit closer now. Okay. Yes or no? Good. Yes or no? Good. Keep your eyes closed. Yes or no? Good. And yes or no? Good. Now I'm gonna get the light really close to your eyes. Keep your eyes as closed as possible, okay? What I'm gonna do is I'm just gonna carefully put a little bit of pressure right onto your eyes, okay? So, just sit still. I'm gonna put a little bit of pressure, okay? And do you feel that, yes or no? Yes, good. Okay. And do you feel that, yes or no? Yes. Very good.
We'll run a few tests first. They're very simple tests. The first one is just examining your face. I don't love what I'm seeing, if I'm being honest with you. No, I don't. Let me put on some gloves. Why don't I? We don't really want to contaminate that. Rings over there. How are you speaking right now? Medical history. Interesting. Alright. Well, seems to me like you're in good spirits.
Okay. Let me know one more time. Is the light in front of your face now, yes or no? Good. And what about now, yes or no? Good. Now what I'm gonna do is I'm gonna get a little bit more up close to you, okay? The lights are all off in this room, okay? If you can remember, what color was the wall that was behind me when we began this exam? You can take any guess. No answer is incorrect. I'm just testing your cranial nerves for memory. Let me know in 3, 2, and 1. If you guessed blue, you would be correct. Very good. Now, I'm going to test your intuition. Keeping your eyes closed, I have this lightsaber that changes colors. All I want you to do is let me know what color do you think is in front of your eyes. I'll give you 2 options. Yes or no. Guess which one it is. Okay. Now, I have a light in front of your eyes, keeping your eyes closed.
Unsettling. Let me just clean off right here. Does that hurt? Kind of tender, swollen. That makes sense. Okay, just give that a little wipe. Little wipe. Now the first thing I want to do is get some measurements. There's a lot of protrusions, 3D things that really shouldn't be 3D. And I would like to wrap my brain around that, if I'm being honest with you. So, if you could just look ahead.
No taking a peek. Is this red or is it blue? Red or blue? Red or blue? Let me know in 3, 2, and 1. If you guessed red, you'd be correct. Very good. Now what about now? Is the lightsaber red or blue? Red or blue? Red or blue? Keep your eyes closed. Good. If you guessed blue, you would be correct. Very good. Is the lightsaber yellow or green? Yellow or green? Yellow or green? Let me know in 3, 2, and 1. If you guessed green, you'd be correct. Very good. And what color is the lightsaber now? Is it yellow or pink? Yellow or pink? Yellow or pink? Let me know in 3.
Okay, well, what about this here? Just get a little measurement. And this? Heavens. Okay. You know, the medical journal called me after after your last appointment. I had about 3 months. 3 months worth of meetings. Okay. Oh my. That shouldn't be mathematically possible. Let me just get. Perhaps it's user error. No.
2 and 1. Very good. It is pink. Good. And last one. What color is the lightsaber now? Is it orange or yellow? Orange or yellow? Orange or yellow? Let me know in 3, 2, and 1. If you guessed orange, you would be correct. Very good. You just completed the eye light portion of the exam. I am very proud of you. Good job. Now what we're going to test is a bit of intuition tests with some cards that I have, okay? I have 3 cards in front of me, and there are different items on each card. This is also going to test your memory, okay? I'll tell you what each of these 3 cards are, and I'm going to shuffle the cards up. You take a guess which came first out of the 3 items, okay? So.
It's not correct. You know what I mean. I'm gonna have to bring out the big boy. And this is going to be to measure between your pupils. So look straight ahead. Try not to move. Just gonna inch this closer. Okay. All right. Don't really know what I was expecting. Okay.
The cards that we have are a heart, a tooth, and a fish. We have a heart, a tooth, and a fish. Okay, I'm going to shuffle the cards up now. Keep your eyes closed. Okay, keeping your eyes closed. Which card came first? The heart, the tooth, or the fish? Take a guess in 3, 2, and 1. If you guessed heart, you were correct. Very good. Now, what is the second card that I just pulled? Is it the tooth or the fish? The tooth or the fish? Let me know in 3, 2, and 1. It is the fish.
I take this light here. I want you to look behind me. Just going to see if your pupils. Oh, they shouldn't be doing that. Oh, oh my god. Oh, interesting. Okay, look behind my other shoulder. What? Oh my. What am I even looking at right now? I see. Okay. All right. I would like for you to follow the light.
Very good. Now, using your memory, what item is the last card that is left? Take a guess in 3, 2, and 1. That is a tooth. Very good. So, your memory appears to be very good. I'm going to write that down. I'm going to ask you some questions now. What time do you think it is? Okay. Okay. And how has your sleep been the past 2 weeks, I would say? Okay. And how many hours of sleep do Okay, for this next part, I'm going to ask you to just give me your hand. I'm going to put a little heart rate monitor onto your finger, and we're going to see which sounds and which types of medical things make you feel more relaxed, okay? So just give me your hand. I'm just going to apply that right.
You see it? All right, we're going to start right here. And just follow the light. It's going down, 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 down. It's going to the side. Going to the side, you're right. Up, 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 up. There you go. There you go. Oh, oh, you lost a little. You're losing it. You're losing it. Back to the middle. Okay. We're going to go over, over, over. Come on. Come on. Bring it over. Bring it over. And up. And down. Down, 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 down. Stay with me here. Stay with me. Okay. Back up. And over. Back to the center. You're not even trying anymore. Okay. Follow the light down and up.
To your finger, okay? And just relax. We're going to keep it there for the rest of the exam. Good. What I'm going to test now is your ears, okay? You let me know if the sound is coming from the left ear or the right ear. Are you ready to begin? Very good. Keeping your eyes closed, no taking a look. Let me know if the sound is coming from your left ear or your right ear. Are you ready? Let's begin. Was that your left or your right ear? Very good. That was your left ear. Good. Keep listening. Where is the sound coming from? Your left or your right ear?
And up, down, and up. That was terrible. You know what? Let me just use this here. Hold it, cover your one eye. What color is this? Red. Okay. Okay. What if you cover this eye right there? All right. Here. You already covered that eye. Good catch. Same marker. What color is it?
Where did the sound come from? The left or the right ear? Very good. It again came from the left ear. Where did the sound come from this time? The left ear or the right ear? Very good. The right ear. Good.
Green? Well, the marker was blue, but you saw red with one eye and green with the other. All right. Guess let's try that again. Okay. Let's cover this eye again. What color is this? What color? Yellow. How certain are you on a scale of 1 to 10? Well, if I cover this eye, same marker, what color? Blue. Well, I don't really know how to tell you this, but that one was the green one.
And where did that sound come from? The left ear or the right ear? The right ear. Very good. So it appears that you are doing phenomenally with your left and your rights. Okay. Now repeat the word that I whisper into one of your ears after me. Okay, let's begin. Sleep. 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 And that was sleep. Very good. Relax. 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 And that was relax. Very good. Pillow. Pillow. Pillow.
Do you see green? Both eyes open, you see green. Okay. Interesting. Let's test out this discrepancy here. Cover your eye. Now, I want you to look at my nose, okay? Look at my nose. And tell me how many fingers I'm holding up, okay? How many fingers? No. 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 Unfortunately, you got none of those. Let's try it over here. Okay. Look at my nose. Look at my nose. How many fingers am I holding up? Not quite. No.
And that was pillow. Very good. Blanket. 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 And that was blanket. Very good. Now one last test for your ears. I have a pen here in front of me. And what I want you to do is I want you to let me know how many times I click the pen. Okay? It's also a pen light, so it will have a flash to it. But what I want you to do is keep your eyes closed. Don't take a look. But count how many times I flash the pen light. Are you ready? Let's begin.
Close. Kind of. Okay. Now, without covering your eyes, look at my nose. How many fingers am I holding up? Add them together. A little bit of math here. No. Nope. Let's test your peripherals then. So, again, if you keep your eyes here, I'm going to start with my hands like this, and I'm going to wiggle my fingers. You need to tell me when my hand is out of your peripheral vision. You can't see it anymore. Ready?
Okay. And how many times did you assess that I clicked the pen? Very good. If you said either 10 or 20, you'd be correct. How many times did you think the light went on the pen light? Very good. If you said 10, you would be correct. Very good.
Interesting. maybe if I go a little slower. Eyes on my nose. There. Maybe my gloves are distracting me. Let's try this again. There. Okay. And there. You do not seem to possess peripheral vision.
Now, what I'm going to do is I'm going to ask you, when do you hear a sound closest to your ear? Don't keep your eyes open for this. Keep your eyes closed. No collecting, go. No collecting $200, no passing, go. So, keep your eyes closed. Let me know when you think the sound is coming closest to your ear. Are you ready? Let's begin. Tell me when. Very good. Very good. Very good. Very good.
Have you ever had it? Okay. You're not even quite sure what that is. Okay. Good to note. Let's just have you read the chart back here. Okay. Take this again. There you go. Cover your eye. And what I'm going to do is just point some letters.
Very good. Very good. Okay. Looks like the sensory and nerve function are working properly with your ears. We're going to move on now to a olfactory nerve sensory test and a taste test. Are you ready? Very good. I have several essential oils in front of me. I'm going to ask you to keep your eyes closed because the name is on these bottles. But just using your nose, let me know what essential oil you think is passing under your nose. Are you ready? Let's begin. Keep your eyes closed. No cheating. Okay. Now, I'm gonna pass that over your nose. What essential oil do you think that is? Very good. It's a bit earthy, a bit minty, a bit sweet.
Right here. That's okay. That's totally fine. You know what? I have a good idea. Why don't I get out the kindergarten test chart? Maybe that will be a bit easier for you. So we'll start down here. What do you see? What do you see right here? And this? What about this? Okay, let's try easier line. This. We'll go up a little.
Good. And what do you think that is? Very good. This one is a mint. Is that your final guess? Good. That is peppermint. Good job. Gonna move on next to something a bit more difficult. These will progressively get a little bit harder. On to the next one. Keep your eyes closed. Now, what do you think this essential oil could be? kind of a sweet smell or more earthy? Sweet, very good. And what do you guess that is? Perfect, this one is flower. It is lavender. Good job.
What about this? No. No. Can you tell me what this is? Of course you can't. Okay. I have a few more tests. Now, I actually need to listen to your eye. It may sound a little odd, but there is indeed something for me to listen to back there. So I just want you to close your eyes, okay? Close your eyes, and I'm just going to take a listen. You don't have to breathe or anything. Well, definitely breathe, but you know. Whoa, 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 whoa. It's like a rave in there. Okay.
Okay. Let's continue. Now this one is one of my personal favorites. Oh, amazing. Now, take a guess what this one is. Keep your eyes closed. I'm watching you. Okay, and this one is citrus. You got that right away. What do you think? Very good. It is orange. This one you got with no problem. This one's magnificent. Keep your eyes closed. It's a bit more difficult, so I know you may want to open your eyes. What essential oil do you think this one is? I can see you questioning it. Herbal, like a tea. Very similar to maybe a...
It's like a top hits. Let me take a listen to the other side. Okay. Let me take a look. Close your eyes. I can't hear anything. Is that... Shh, 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 shh. I could not hear anything. And the other side sounded like Ultra Music Fest. Okay. No, that's not normal. Not in the slightest.
Yes, like
So let me get the
sleeping aid. Maybe like a room spray. It's very often used in that. Take a guess. It's floral. Very good. This one is chamomile, but I'll take floral. You did very good. Okay. Again, these get a little bit more difficult. We're on to the last one now. I love this one. So, keep your eyes closed. This one smells a bit like, yes, very good, kind of like citrus, but not too much. And a bit like earthy. Yes, maybe like, yeah, some sort of something you can eat. Maybe a tea. Any guess? I'll take any guess you got here. Any sort of citrus, very good. This one is vetiver. It smells almost as if it's lemon.
It's gonna get pretty close. Just try to keep your eyes open as much as you can. And I'm just gonna get this close to your eye and a little puff, puff, puff of air. It's gonna measure the pressure in your eye. Okay, ready? Let me try that again. Thing's broken. Something wrong with this. Switch a little. Okay, one more time. Look right ahead. Okay, let's measure the other one. Stay still, stay still, stay still.
used really well for a room atomizer. Now we're gonna give you a taste test. Okay. So, what I have here is a taste test tube. This is either sweet or spicy. Okay? And you have to let me know what you think it is, sweet or spicy. Keep your eyes closed because the bottle could let you know what it could be. Okay? So, is it sweet or spicy? And say, ah, very good. And then just do this.
Well, I am not too pleased with the pressure. The numbers I'm getting back are alarming at best. The fact that your eyes are still solid and not liquid is making me question basic chemistry. So I'm going to need a little sample. Alright, so I'm going to put the gloves back on for this. Just one glove, I think, is all I need. And I'm just going to have you look up, and I'm just going to right there.
And taste. Very good. And I can tell very clearly that this one is spicy. Very good. That one is an extract of cayenne pepper. So that is what we always like to test to make sure your cranial nerves are working well with your brain. Okay. Now, I'm going to ask you to remember one number for me. Okay. I'm going to ask you to remember the number 11 for me. Okay. Remember the number 11. I'll bring this back right at the very end. So remember the number 11 for me. Very good. So, behind me, I have something known as a Snellen's chart. You're not going to be able to see it because your eyes are closed.
Look up. Okay, I'm going to send this off to the lab. I will warn them that it's coming. They're going to give me a call. The CDC will probably get involved. And I'm just going to have you can just book the rest of the appointments that I have for the week. Hey, Matt, I need you to cancel all of my week's appointments. Mrs. Jones will have to suck it up. No, this is beyond an emergency.
And was that the soft or the sharp side? Very good, that was the sharp side. You did amazing. Good job, keep your eyes closed. Okay, we're gonna have you rest here for the rest of the night. I'm going to check your pulse oximeter from your finger really carefully. And I'm gonna gather this information right onto my chart as to which ones helped you relax the most, okay? Very good. Now, a nurse will come right back into this room and finish up the rest of the exam, but keep your eyes closed until then. Thank you for not taking a peek and taking a look. But be honest, if you did, we have to restart this exam from the beginning, okay? Very good. Just relax, and I'll check your results, and I'll let you know by the morning time when we redo this exam. Unless we have to redo it again because you opened your eye as you pinky promised, okay? So, have a good rest of your night, or we're going to redo this exam right from the beginning, okay? Very good. Now just keep your eyes closed.